the 24th of March 2013, after threatening the government for several months, columns of Seleka rebels entered Bangui, prompting the president, François Bozize, to flee. As the capital fell prey to pillaging and violence, MSF, which has been operating in the Central African Republic for more than 15 years, began treating the wounded.
In
March, we began providing surgical support at the community hospital, operating on injuries caused by the coup, so bullet wounds, stabbings, or just the results of beatings. Roughly speaking, around 800 people have been seen in the emergency department so far.
The two other MSF hospitals in Pawa and Kano haven't really suffered from the violence and are still operating normally. But in Bangui, work is constantly jeopardized by the insecurity. MSF's offices and the expatriates' houses have been pillaged, but there's been no physical violence.
The security situation is improving gradually, but it's still risky. There's still sporadic shooting in town every day, and pillaging, but not on the same scale as a month ago. But it's still there anyway, and it's just as dangerous on the roads in the interior of the country as there are rogue Seleka groups taking members of the population or NGOs hostage. In mid-April, MSF called on all parties to respect medical personnel and facilities and access to healthcare for patients. Humanitarian aid is already largely insufficient, and thousands of people are in need of care.
Au niveau du personnel infirmier ou du personnel de santé du ministère, peu de gens sont vraiment maintenant sur les lieux de travail.
Not many of the Ministry of Health's nursing and medical staff are actually at their posts. There's no access to medicines and medical supplies in the interior of the country. And the rainy season will be back soon, bringing more misery with malnutrition and malaria. And then I honestly don't know what will happen. We're worried about the crisis taking on even bigger proportions in the coming months. The crisis underway in the Central African Republic is not new. It has been silently eating away at the country for the last 20 years. Long before the events of last December, it was already suffering from a chronic medical emergency. And to make matters worse, people are now flooding out of the country. At the beginning of April, neighboring Chad, which has been taking in refugees since the start of the crisis, saw 10,000 people cross its borders in just a few days. Arriving from the north, they tell tales of villages attacked and burnt to the ground and family members murdered.